Surviving Veterinary Medicine. Be smart, be bold, be creative, and be your own boss. At the very least, find a practice where you can do what you do in the most positive way that gives you the space to practice medicine as you see fit. Because at SVM, we set a higher standard for medicine than what you learned in school. For today's podcast on surviving veterinary medicine, I'm delighted to bring you Dr. Danielle Anderson from the Southern Ontario Animal Rehabilitation, or SOAR, Veterinary Clinic. Dr. Anderson is a popular teacher and speaker on medical acupuncture and integrative rehabilitation for animals. She has been teaching with us for several years at the Medical Acupuncture for Veterinarians, or MAV course, and she is now a major instructor for us in our MOVE courses, which are CureCoreVet's new rehabilitation programs in orthopedic and neurological rehabilitation. We begin our conversation talking about just the status of veterinary medicine and how so many practitioners and students are looking for something more. And when they see the joy and the results, the clinical outcomes that can be had by integrative medicine and rehabilitation, especially done scientifically, they become very enthusiastic about wanting to learn more.
That's not an uncommon thing that we hear, though, right? So that's the problem. So when I did my talk at the vet conference, I had multiple people reach out to me. One was so there's a lot of mentoring sort of stuff happening. And I've had a couple vets reach out to me. One was from down south somewhere, Texas maybe, through the vet rehabbers community. And this girl found me on her own and said, I'm looking at having babies, but how do I manage working and having a baby and doing all these things? And she's like, can we talk? And I'm like, absolutely. So I called her and she was blown away, that I would call her. And I'm like, but we need to do that. We need to reach out to one another, because I wish someone had freaking supported me. Right. When I was going through all I was going through.
Right.
I was talking to her. She said she didn't know that cases like Twist and cases like some of these others, that they could do well without surgery. Right. Yeah. She had no idea, because we don't learn that in school. And I would love to take some of those neurologists and have them come spend a day with me. And, maybe they can reason through in their head that, oh, well, it's going to get better, or it's not. So maybe you helped, maybe you didn't, which is usually what we hear. Well, you can go, but maybe it'll help, maybe it won't.
And then Dr. Anderson describes the response of a colleague who saw how Danielle was treating animals at her clinic and getting results.
Again, she came to spend a week with us and stayed for a month, because she's like, oh my God, these dogs are getting better. And she had never heard of that, and she had never seen it before. And so I think that's where we need to just start reaching out to everybody and saying, I'm not saying don't always do surgery. I'm saying don't always do surgery. Yeah. But I'm saying, yes, surgical intervention sometimes is a good idea, but we also need to look at the big picture and understand and communicate to these clients that there are potential huge repercussions there, right?
Even though they're academicians, they don't study outside their little box. They go through their little tunnel in vet school, then they get accepted as long as they're playing by the rules and everything. They get accepted into residency, and they're always in their lane. Mm-hmm. Aside from those that do reach out, not all neurologists are uninterested in changing things. But so I think that's part of the problem too, is the general intimidation maybe by those not in a university. We were even talking about it today in large animal MAV, and just realizing that people's training, even in the big colleges or whatever, is narrow and limited, and their word is not gospel. Like even clients are led to believe, oh, I'm going to the university.
Right. And that's how I graduated. I graduated going, well, that's what I was taught. Right. And right. These are the people that know everything. They're the ones that taught me. So then you kind of start questioning everything. And I don't dislike Western medicine. I pull it all together, but
Right.
I just think people need to think outside the box. There's a reason I find things that, and most recently we had a case that was seen by a vet, diagnosed as a SOAS, went to OVC, they diagnosed a cruciate, the dog wasn't getting better, went back to OVC, they said, no, cruciate's not there, and they were going to do surgery, and then the dog's still lame. It came to us, my technician went, I think this dog's neuro. I'm like, yeah, it is. So she videotaped it, and we looked at it, and the owner was like a nurse, and she's like, I've been saying this dog's neuro, and no one would listen to her, you know? So I think we just have an ability to look at it from a different perspective. We're not discounting everybody else and their opinions, because some of them are very good at what they do, but it's just a different point of view. I mean, I call Tara and Sarah all the time, and I'm like, can you just look at this? And they do the same to me. So I think it's just understanding where you might have a limit and then reaching out to someone who might be able to help you, right? And not discrediting us.
Well, yeah, but we're kind of like, even, especially because the stuff that we do is scientifically based, it's the same science, it's the same approaches that have been taught, but we're actually using them and thinking broadly, and this should be standard of care.
Mm-hmm. I agree.
Yeah, and having a broader differential diagnosis. So anyway, we'll have a lot to talk about, I think.
So I graduated from the Ontario Veterinary College in 2002. I did my bio-sci degree before that. And, you know, growing up, there is nothing in this world I wanted more than to be a veterinarian. It was never an option to do anything else. So I graduated, and I think like most new grads, I was hesitant about my skills. I knew what I was good at, but I felt like there was a lot to learn. And I struggled with finding somewhere where I ethically thought like everybody else, and that I was also supported at the same time, which seems like it should be, you know, completely easy to do, and it's not. I never worked for corporate. It was always privately owned companies, but it doesn't always come without complications. And so I think I was 2 years out of vet school after my second practice I had attempted, and I considered leaving the profession, which was horrible. And so my sister-in-law, who was also my classmate, got pregnant and offered me her mat leave. So I went to work at her clinic, and it did 100% reinstill my faith in veterinary medicine. I went, okay, so privately owned company, they treat their staff well, it's well run. She practices amazing medicine, so did her partners. So I was like, okay, now I just need to find another practice like that. And I did. And, you know, I worked for a long time in general practice, and I really just wanted to own my own thing. You know, I had a great gig. I made good money. I was still, you know, I would still get, and I'm sure everyone does, you get all of these weird cases coming in that are lame, and you can't figure out what's going on because you're taught range of motion. There was no myofascial palpation being taught when I went to school. X-rays would be normal, and you're like, I don't know what's wrong with this dog. And I found it horrendously frustrating. And, you know, I also would have these senior dogs come in, and the seniors, you know, you put them on their NSAID, or they have kidney failure or kidney elevations, and you can't put them on an NSAID. And you're like, well, what do I do now? And often the answer was euthanasia, right? Which anyone who knows me knows I'm probably one of the most sensitive human beings on the planet, and I cry all the time. So it was really disheartening to go through that. So I ended up getting my rehab certification after I had my daughter. And I was like, okay, like I've got this. This is what we're going to do. This is going to totally change everything. And while the certification was extremely thorough and great, I went back into practice and went, how the heck do I incorporate this into my day? And my boss, who was super supportive in me getting certified, I think from a monetary standpoint, was really, really hesitant on how it was going to work to pay me well and to not lose money on the deal when we were seeing these appointments. And keeping in mind that integrative medicine, whether it's rehab, acupuncture, any of it, the revenue stream isn't just about that bottom line, right? You are going to generate maybe less revenue when you look at an appointment basis, but man, the loyalty from your clients, the trust from your clients, to the point where, and I'm kind of getting ahead of myself, but to the point where you say, you know what, it is time. We need to do some x-rays or we need to do some diagnostics. They're like, okay, well, we trust you. We have that relationship with you. And you don't always get that when you see them once every year, every 2 years for vaccines or a general physical, right? So I ended up leaving that practice because I really wanted to do more rehab and own my own place. So after locuming and trying to buy practices and, searching for a few years, I finally opened this place that I own now, which is SOAR in Burlington. And I really had a lot of requests for acupuncture. And I had gone to multiple, and it was NAVC at the time, it's now VMX conferences and the Western Vet Conference, and I loved them and they were fantastic. And I would sign up for their acupuncture stuff, and it was all Chinese medicine based, but I just thought that's what acupuncture was. I didn't really have any knowledge about it outside of that. And so I did some workshops and everything, and I was like, okay, I've got this. And I get home and I'm like, I do not got this. So I was like, okay. So I was working at a practice part-time while I was running SOAR, and the owner was like, well, did you look at NARDA's course? And I was like, I don't know what a NARDA's course is. And she's like, it was One Health Sim way back then. And she was like, it's all neuroanatomy, neurophysiology based. And I was like, I don't know if that's much better. And she's like, trust me, try this. So I signed up for the course and I was like, okay, so it wasn't like starting from new and learning a new language, because I do have some neuroanatomy and physiology in my brain way back when in vet school. I had to relearn a lot of anatomy, but I'd already done that in my rehab certification. So I was like, this makes sense. And the more I did it and the more I talked to the amazing people in the program, I was like, you pull it all together, and it was probably the best thing I ever did at SOAR as far as pain management and client outcomes, patient outcomes, things like that. So that is what I do full time now, acupuncture and rehab. I will say, for the most part, I've scaled back on the rehab portion of things, and I pass that off to my certified techs because the acupuncture is really busy, the pain management's really busy, and the second opinions are busy. I think, especially right now with COVID, I think general practitioners are so overwhelmed, and they're not just corporate. They are everywhere. They are overwhelmed. It is super, super busy. They do not have time sometimes to sit down for half an hour with these stressed out clients. A lot of surgeries got pushed back because of COVID or canceled altogether. Referrals were really, really tough to get. And so we were slammed. And I can't say I don't enjoy it, because I actually really do. We really enjoy working through some of these tough cases. And I mean, you and I have talked about this. It's not that nobody else is capable of figuring out what's going on with these animals. It's just a different perspective and way of coming about that problem. And as far as acupuncture goes, I mean, they respond so incredibly well. And it's nice to have some rehab background as well, because let's say, because it does happen, let's say you have a patient that they are just not having acupuncture. They will not do it. They will not sit for it. There's nothing you're going to be able to do to change their mind, whether it's using the smallest needle possible, or maybe it's the owner, because we've had owners that are super sensitive with regards to acupuncture. They've had bad experiences in the past. It's nice to have other options, because once you've used your kind of new way of examining these patients and gotten your diagnosis, then you're like, okay, well, if acupuncture doesn't work, what else can I do? Or if rehab doesn't work and they won't walk in a water treadmill, or they're deaf and they're blind and they can't really do therapeutic exercises, what can we do for them? It's nice to have all of those things and kind of integrate it all together. I see stressed out vets, I see stressed out techs, and I think there's so many different reasons for it, in my opinion. I think a bit of it is, yes, there's corporations that it's a very business oriented sort of model, right? And there's a lot of practices that operate, and I'm not saying it's wrong. I'm saying it 100% was not for me. There's some vets that are so type A personality. They like being busy. They're in and out in 15 minutes. They're okay with that and they can do it. I really like my appointment times being a half an hour to an hour where I can really spend time and be patient with that animal, not rush things. Because some of these animals have had really bad experiences before. And the last thing I want to do is jump on them and hold them down and do what we need to do. And, and then it's just made things 100 times worse. So I think in regular practice, especially with things being as busy as they are, with clients not being allowed in the building a lot of the times, I think you're doing 100 times more things, right? You're going outside after, or you're calling them on the phone, or you're having to email them. And the stress is real, even for the best of veterinarians who have type A personalities. So I think having an option like rehab or acupuncture where you can just, even if it's for part of your day, just settle down. For me, when I was in regular practice, that was my surgery time. And I know you're not a huge surgical fan, you didn't love it, but I mean, it was my, even dentistry, right? Where you had just a couple hours, you could just kind of tune out, kind of regroup yourself and do those surgeries, whether it was a spay or a neuter, or whatever the case may be, or a dental. I liked that. And I think I liked it not because I really loved surgery, but I liked that aspect of surgery. And so I think we need to find time in our day to make sure that we're just taking a deep breath. And so it's funny because I was talking to someone this morning, they're like, Danielle, you just need to take a deep breath. I'm like, I guess I do. And it's funny that I'm making that recommendation now, but it's true. We all need to do it. And, in our day, I can't imagine going back to that environment where it's just go, 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 go. And, emergencies are being brought in and emergencies are being squeezed in because there's nowhere else to put them. We squeeze things in too, but it's such a different environment. And you don't need to leave general practice to experience that. It's a pretty good option to incorporate in your day if you work at a practice that will let you do that.
Mm-hmm. Well, and I think that what we talked about before is, we're both super sensitive. And I think that also means that we take in a lot. We're sensitive and there's a certain amount of stimulation out there or data. And because we are affected by a lot of that, at least speaking for me, it's overwhelming. That's why after I was planning to be a neurosurgeon and then realized I didn't want to do that all day. And then there was a period of time where I interviewed for psychiatry residencies till I saw how crazy that whole system was from the provider end. Just being able to sit and, whether it's not necessarily philosophize, but to absorb somebody's story. And because I can't just shut it out. That's how, especially in medical school, because I knew better by the time I went to vet school, but just the walls I had to put up around me and around my heart and everything, it took me a long time to get those walls just broken down. And then there was some PTSD stuff, not like being in a war zone, but even after vet school, it's just like, I was thinking, why did I even do this? So for me, my survival of veterinary medicine was because I know I can't be around euthanasias. It's just so many things that I can't do, but I can do this little piece. And I enjoy helping others learn how to do this, especially people like you. There's lots of people like us that want more of a bond, just that we're sensitive. We can, I think, understand how the animal is sensitive and feels overwhelmed or fearful or painful, and they don't want their necks being cranked around and everything. And I think that's a lot with empathy there.
Totally.
Yeah.
Yeah. And I think, you have to also be true to yourself. So, I think it's easy in veterinary medicine you see a lot of judgment towards each other, judgment towards other vets. And I think I've had to correct myself multiple times and go, Okay, so yes, I'm not happy with the way that relationship ended. That doesn't mean that that person, that vet, that tech, that whatever is a bad person. It means we are just not good at working together. We have very different personalities. And I'm trying to adopt that more because I think you have to be true to yourself. And, the number of people that said, Danielle, you need to just get over it. You need to stop crying so much. You need to not be all over the place. And I'm like, I get that to an extent because it can be exhausting, but I'm never going to apologize for sitting on the floor and crying with an owner. I'm never going to do that because that is who I am. And I've developed that relationship with that family. And I have an inability to shut that empathy off and compare it to myself when I lost my dog, or to see in the future when that's going to be my kids saying goodbye to that animal they've had for 15 years, right? I can't. It has to be controlled. And, I think you can't let it get the better of you, but I think you also need to just be really, really true to who you are. And maybe you're not that emotional person. Maybe being true to yourself means that you are completely stoic in all of these situations. And as much as I need to reel it in, maybe, channeling some empathy isn't necessarily a bad thing either. And I think clients are drawn to people who are empathetic because they don't necessarily get that, especially in very, very busy referral hospitals where, you're in and out. Academia is much like that too. They do not have time to sit down with you and hold your hand and go through everything. But that doesn't mean clients don't need it.
Right.
And there are vets who that is the 100% last thing in the world that they would want to ever do. Mm-hmm. But I like doing it and I want to do it. And so I think for people like me or you, I think that it's a good option, right?
Right. And I think that a lot of times the people that refer to us are happy to have us take those clients.
Yeah. Right? Yes, I agree. Yeah. Yes.
And spend that time. So it can work out, but it's just, I think that the frustrating thing is how much suffering there is out there that doesn't need to happen, that if there was better medicine, better astute diagnoses. And I just personally think that I would like to see veterinary schools, I'd like to restart a whole one from the freshman year and on, and really integrating the anatomy of acupuncture, the physiology of it, photomedicine. And I think that I patterned that after my osteopathic education, where from the beginning, it's a lot about structure and function and movement and endogenous methods of healing. And I see that if we could do that with veterinary medicine, and that's what we try to approximate with the CuraCore stuff, that it's just part and parcel, that wouldn't it be exciting and illuminating for people, instead of memorizing structures and muscles and attachments? It's like, look at, this is where the Golgi tendon organs are. There's a lot of fascial innervation there. And that's where a lot of acupuncture points land, because we can influence muscle tone and function and release fascia. You could learn in so much more deep ways about how the body is built. I find it intriguing, and I think it would be a big leap forward for medicine in general.
I agree.
We interrupt this podcast to bring you an important message from CuraCore VET. If you want to deliver better results, more efficient care, and have a better time doing so, you should strongly consider registering for the Medical Acupuncture for Veterinarians Master Class. Topics include structures of clinical relevance on the head and neck, the trunk and pelvis, the thoracic limb, the pelvic limb, and the sympathetic and parasympathetic nervous systems. Email us at info@curecore.org.
There's such a huge relationship to structure and function, right? You go to any of the conferences now, there's multiple lectures on structure and function and how they're related. So why is that getting missed in vet school? I have no idea. So I think, reaching out to these students when they're vet students and kind of saying, think outside the box, right? You get so focused on that dog is lame in the knee, the dog is lame in the knee, the dog is lame in the knee. It must be a cruciate or it must be hip dysplasia. And I'm like, did you check the hock, right? And did you check the front end? Because is there anything going on up there that might relate back? And so I know when you've had me teach anything for acupuncture, I cannot focus on just acupuncture. It's super, super hard for me because it's such a huge part of why we do what we do, because you've taught us to look at the whole animal. And I think that's where we become better practitioners. And it's hard. It kind of reminds me of, when you go to human hospital, it's so compartmentalized, right? Everyone's, like you said, stays in your lane. And as much as you want people to like stay in their lane as far as their certifications and their capabilities, it doesn't mean that you can't look and go, I'm an orthopedic surgeon, but that dog 100% looks neurologic, right? And let's pass that off. And I've had amazing, amazing boarded people do that. And those are the people I tend to trust and want to refer to, because I think, you're like, yeah, you're looking outside of your lane in kind of a big general picture. And I'm like, I need that. I need that in my life.
Right. And if they're patient-centered too, rather than in some practices, if they're like, I want to do 5 TPLOs a day. So
is that a thing that they want to do that?
Oh, I think some people, it being a multi-billion-dollar profession, income generator, and now that they're doing TPLOs on small dogs, I mean, so that's another whole, thing.
Well, I think I'm spoiled a little bit. Some of the referral surgeons and neurologists that we have up here, especially in our area in Ontario, they're really good at, like, we've had several go, yeah, surgery could be an option. Sorry, my dog is losing it at the window. I think they're pretty good at going, you know what? Yes, surgery, but I'm still not convinced. Why don't you try this first? And I'm like, to me, that's fantastic. That's what we want, right? And even with, neurologists, we have some amazing, amazing neurologists up here that then look at it too and go, well, we're still ambulatory. Could we try conservative management first? Yes, we could do that. And so it's not necessarily the completely quadriplegic dogs that they're recommending conservative management for, which, they're going for surgery, but they are at least talking about it. And that's huge. That's a big difference from, 15 years ago. So I think the next step then is to let general practitioners know that those patients coming in that are quadriplegic or completely paralyzed on just their hind end or whatever the case may be, that they can't go for referral, there's still options. And I think that's where we need to start addressing things, and clients for that matter, right? Clients are the first ones that are like, hold on, my friend's dog didn't go for surgery, did get better. And yes, it is not 100%. There is not a guarantee that I can make your dog walk again. But let me tell you, I've seen some pretty horrific complications post-surgery, whether that's orthopedic surgery or neurologic surgery. And I think we just need to have those open conversations with people so they understand.
Right. Yeah, because what I've heard and seen is when surgeons that, as the first person that clients might see, when they advise against acupuncture or rehab or keep them in cage, so strict confinement for weeks and weeks, and then they've had all kinds of functional changes and can't necessarily even walk again. You have so much repatterning of the nervous system that would be required. But yeah, and just getting out that basic science understanding. Maybe we assume that neurologists might understand, and maybe they do, the primary and secondary pathophysiologic effects of spinal cord injury. But maybe what they don't get is that acupuncture, photomedicine, massage, therapeutic exercise address directly from a mechanistic standpoint all those features of secondary pathophysiology of spinal cord injury, which is the cause of so much morbidity and long-term neurologic deficits. Surgery only addresses the first one, maybe, but there's all kinds of trauma that happens. So if, let's say I was a client and let's say I have my dog here, my dog can't walk and I couldn't get in for a referral. So can you help him? And if so, how would that work?
What was wrong with your dog? I missed it.
He can't walk.
Oh, he can't walk.
He's down back end.
I'm like, yes, we can try and help. So let's say, because Opie, and we've talked about Opie before, and Opie's parents are lovely, so I talk about Opie all the time. So he had come to me. He had been referred by his vet. They did all the right things. They talked about referral. They ended up saying, okay, conservative management. The dog was ambulatory, just a little bit painful, just a little bit not wanting to jump up on the beds and do stairs and things like that. Little dachshund and adorable. And so they started on all the meds. They referred him over. 3 days later, when he was supposed to come, he woke up paralyzed. And so when the owner called, I picked up the phone and I said, do you still want to come here? Do you want to go right to Emerge? And she said, I think I want to come see you first. So I said, sure, brought her in. And he had no deep pain. He had no movement. He was very, very sad and very, very painful. And we discussed referral. He's also a doxy that had 4 visible calcified discs in his spine. So who knows what was going to happen to that poor dog? And so they said, we can't. And at the time, OVC was at capacity, so they couldn't guarantee they could see him even that day. Although because he was acute, they were hoping that they could. So they said, you know what, let's try conservative management. And it was acupuncture. It was muscle stim. It was eventual therapeutic exercises. It was pain management, right? We wanted to control that pain in his back. And it was communication. I spent a very long time talking to them and educating them and talking about what the future is going to look like. So if they went for surgery or if they conservatively managed, and there were potential reoccurrences. And I know what the studies show, right? I know the studies show that you have a greater chance of reoccurrence with conservative management. But I don't know if we have the proper studies to really say that.
See, I would disagree because in my talks, I point to the data that shows more recurrences with surgery. I mean, what are you doing? You're destabilizing the spine. You're rongering out bone and you're messing with the proprioceptors on the muscle. And then by the second time, there's one report that talks about, if a dachshund has a second surgery, then 50% of those get euthanized because people say, I can't do that to my dog again.
Right. So I will say, and again, are we just seeing a different skewed population of patients, right? So with Opie, he came back a year later, again, starting to have that stiffness in his back. So we treated him again. I think maybe 2 or 3 treatments, and then he's good. So the owner knows what to watch for. The owner is very good at monitoring and keeping up on things. And so he hasn't, oh my God, knock on wood, haven't seen him this summer yet. So, but then I look at some of the other dachshunds that have had surgery, and those dogs have gone for surgery. And then a month later needed another surgery. And then a month later needed another surgery. And we have at least 6 dogs I can even think of just offhand that have had multiple spinal surgeries.
Right.
So, and sometimes in the same spot. And I'm not saying that they did something wrong. I'm saying this is a potential problem and a potential consequence of this surgery. And I don't always know if clients intake that information that is given to them because they're so stressed, right? They're so stressed. These dogs are painful. They're down. They think their dog's never going to walk again. They're told we can do surgery, we can fix. Great. Sometimes these dogs end up incontinent when they're picking them up. And they're like, oh my God, we didn't know this was going to happen. They probably were told, but when you are that stressed out, do you take in that information? I know you're
Yeah, right. I'm shaking
maybe they weren't told.
Maybe they weren't told, or when they get a PPLO, they're not told about osteosarcoma and all that. Yeah, and I think that there's blaming of the client, like, oh, yeah, maybe the dog was thrashing around in the cage or whatever, or look, another thing happened. I mean, yeah, that need for another surgery, like even when I would be at the institution, I mean, it's just like blaming the dog, blaming, but never really like, oh yeah, we didn't tell you that this happened. And they don't even, I don't think, have statistics on the tip of their tongue about how many do. I think that there's a certain amount of blind spot there, or hemorrhage, or like I'm saying, that poliomyelomalacia. If clients at that study out of Georgia had been told, here are the risks, or even somebody else, now they're okay. In JAVMA, there was just this report of 3 dogs who after surgery all succumbed to this ischemic event of their cord after surgery. Or, yeah, okay, maybe you can try acupuncture and rehab and all that. That would be another option. What do you want? The risk of dying? Nobody that I know has ever died from a veterinary acupuncture appointment or laser or rehab. And then the amount of money outlay.
So, would it be then, you would think, important to, because it's really not the fault, I can't fault personally the surgeons, the neurologists, the specialists, because when they go through their residency programs and they go through all this stuff, there's no one standing there going, okay, let's try doing a study on acupuncturing these dogs instead of doing surgery, or let's do a double-blinded study. Like, that's not happening. So they're shown and taught, right? And it filters down through generations. This is how you deal with these situations.
Right.
So, in saying that, it's fantastic that these individuals still refer for these things. And it's good that they're accepting them as treatment plans. But, it would be nicer to have some data to say, hey, if we didn't do surgery on this dog, this grade 2 or grade 3 IVDD, could we still get a benefit?
Right. Well, and even with my recent experiences with trying to submit a letter to the editor of JAVMA for publication about these options, I had cited several studies out of JAVMA that have looked retrospectively for some of them about dogs that got electroacupuncture and how did they do electroacupuncture with no surgery, electroacupuncture with surgery, or just surgery. And the dogs with just electroacupuncture did better. And of course, it's retrospective, but JAVMA published it. So we do have several studies on dogs. And so we have target species specific information. We have basic science physiologic information. And yeah, I tend to be a little bit less peaceable, I guess, about my interactions, because having been at the institution for 20 years, it's like, okay, by this time, don't you think we should? And so it's when they know and then they don't refer.
Yeah.
But I do think the fact that it's scientific, I mean, in the general scheme of things, it's not like you have to refer only to people that imagine invisible cheese and things like that going through the body. So it's nice, I think, probably maybe for some, that they can send it to somebody that understands the science behind it.
It's always exciting to me, and the staff kind of giggle because I'll be like, oh, the vet college sent us another one and specifically said we should try this, and it makes me so incredibly happy, that they would trust us to do it, or that I'm getting residents, especially surgical residents, reach out and go, hey, any chance you could see this dog? It's not getting better, blah, blah, blah. Well, that's great, right? So that's where we need to get them. So if the residents are reaching out, then that means once they're boarded, they're still going to reach out. They're going to refer. In our area, we seem to be seeing more of that. I don't know what that's like internationally or throughout even the States, but I know in our area, it makes me very happy to see it more and more. And I think, again, all of a sudden, you treat one patient at a hospital, and then, those vets, they may never have even known that this was a thing. Maybe it's never even on their radar because they're so busy, but, you treat their technician's dog, or maybe you treated their dog so all of a sudden, maybe that vet's in a position where surgery is not an option, and, or they've been told that there's nothing else they can do. And they're like, hold on, that Danielle chick, she might actually see our dog, and then all of a sudden you've earned their trust. And
Right.
I think that's how we keep spreading the rehab and acupuncture love in our area anyways. And you see more and more individuals starting to open these practices and do these things, and I think it's super, super important.
Right. And that's
clients want it. Clients are seeking these things out, and not just to avoid surgery. Like, clients really, they've been through physio. How many people do you know who have had knee replacements or knee surgery or cruciate surgery? I'm like, I think 3 of my staff members had cruciates. They've all gone through physio. They all know it's important. So we just need to continue to spread that and let everybody know and educate people.
Yeah. Well, and you're one of the best messengers out there, of course, making those inroads.
Thank you.
You're welcome.
I try.
Yeah, you're doing well.
We're seeing some amazing cases. I know we're going to start chatting about those kind of in a teaching platform. I encourage any GP out there who is feeling stuck. You know what? I really hate COVID because prior to COVID, we had so many people come hang out with us, and whether they were volunteers and we were trying to inspire them to do something really amazing with their lives. And they could be high school students, they could be kids who wanted to go to vet school, maybe they were tech students, any of those things. And so sometimes they were vets and they just wanted to come hang and see what it was that we were doing. And I miss that because we can't really do that right now. And I'm hoping in the future we'll be able to do it again. And just, I think, opening up our practices and saying, because my husband's funny, he's always like, so I don't really understand. Why would you train people to do what you do? Because doesn't that mean then you won't get the work? And I'm like, yeah, but I can't see them all, right? There's just no way I can see every patient. None of us can. And we have to be aware of that. So we have to collaborate. And if that means also teaching one another and saying, hey, have you tried this? Or does anybody else have any ideas about this patient? Because I can't seem to get any headway on it. I'm like, I think that's what we don't need to do. We don't need to shut it down and go, this is mine and you can't do it. And you definitely can't do it as well as I do it, because that's not true. It should all be about collaboration and kind of helping each other out. That's my opinion. So hopefully one day COVID will not be such an issue and we can have people back in the practice to kind of learn more about what it is we do, so that maybe that's something that they'll pursue in the future.
Yeah. Well, I think, based on our last teaching session, even seeing video of your treatment and meeting you through this kind of platform, I think that's the next best thing, is having that available, which can kind of broadcast and gets to more people at one time too.
Sure. And clients, and social media is a pretty incredible thing that I've only started using in the last couple years, but it reaches maybe not necessarily vets, although we do have some vets that follow us. It reaches everybody. And so it's really funny because sometimes you'll get someone who comes in, to the practice and they're like, we've been following you on Instagram for like 2 years. I'm like, really? And they're actually excited to be coming to the practice. I'm like, you should not be excited that you have to come see us, because that usually means there's something wrong with your dog. But they're excited about it, and they're excited to see all of the different things that we can do and that their dog might be able to do. And I think it's way more fun than going to, a regular practice and getting some vaccines and some blood work done,
Well, exactly.
It's exciting.
Yeah. I mean, whether it was a kid that was thinking, that loved animals like we did and thought, what can I be? That was part of me going to med school first, as I volunteered at a vet when I was 16. And I saw the euthanasia of a 1-year-old cat just because this person would cycle through kittens every year. And I thought, okay, never, ever am I going to do that. And it's like, I can't even approach veterinary medicine. And so to see a joyous practice like yours, and just with all the burnout and everything, again, surviving veterinary medicine started because of the suffering that veterinarians have. And like you saw, and you found a path to another way. And I think it's great for vet students to learn about this, and then vets, and even, with this last group that we had through today, I mean, there was one person, she was planning to sell her practice in 7 years and then do acupuncture. And that was for when she was here with the small animal portion. And then she was here today with the large animal. And she's like, I have sold my practice and I'm moving to, to this new house, new state where I wanted to be. And I just didn't feel like waiting for 7 years. I want to do it now. Yeah.
That's awesome. And the other thing is, so let's say you are a general practitioner and you're like, I actually really like medicine and surgery. Like I like general practice. And there are vets that do. And we need general practitioners, right? We can't exist without them. So, but that doesn't necessarily mean not knowing about these things isn't advised either. Because again, I remember being in general practice, and having those seniors and not having options for them. And I remember there was one vet that was doing acupuncture in our area, and people would seek her out. And I was like, I have no idea who this woman is, but okay, well, it can't hurt. Like, go get acupuncture done. And they loved it, and they did so well. Having that option to refer and not go, well, we've hit the end of the road, right? I'm sorry, your 14-year-old dog is lame. You can't take NSAIDs. I guess we're done. And now you can say, you know what? Not true. Right? Why don't you go try some other things? Not every client is going to want to. Not every client is going to want to take their cat and put it in a water treadmill. Not every client is going to want to spend the money and the time and the effort to go to these appointments. But holy Moses, there are a lot of clients that are. And I think, if every single clinic has even 20% of those A clients that will do those things, then I think that takes the relief off of our shoulders, that we're like, there's 20% more that I didn't have to euthanize today.
Right. And as a survival thing, the patient has survived. The client whose heart would have been broken, and that might be their lifeline, that's the most special being to them, they've survived better, and the repercussions through the family. And then the practitioner who hates that part of their job, meeting that brick wall, they're better. I mean, there's evidence, like in the human profession, how learning acupuncture reduces burnout, and it just makes for a healthier work environment, I think, as well. So, and the other thing I was going to say, whether it's whatever neuro things or also orthopedics, that, if you're not slammed because of COVID and everything, but those practices that are interested in keeping their patients in, it's like, so a dog has hind limb lameness, you do not have to send them right away to the orthopedic surgeon and lose them to follow up or have whatever dastardly things might happen to them, in my words. But anyway, but you can keep them in the practice and build that in, like you're kind of suggesting too, is that could be part of what happens in your practice, and you're doing better medicine and you're keeping your clients there close to you.
Yep. Yeah. I mean, I think it's funny because some of the seniors that have been referred to us, 1 year, 2 year, 3 years out, whatever the case may be, they're always super thankful for their vet who sent them to us and then to us. Right. Yeah. So their loyalty is still, unless they found us on their own, and then they're angry, right? Mm-hmm. They become, well, why didn't my vet recommend this? Why would my vet have sent me here knowing that this was an option? I'm like, and then you're like, well, maybe they didn't know it was an option. So now you tell them about it, and now they know that this is an option for the future, right? Mm-hmm. So I think, again, it's all about education, and it's one baby step at a time. Right? I didn't know this was an option. Maybe it wasn't an option 20 years ago, right? But now that we know it is, it's becoming more mainstream, and it's our job to just make sure everybody's educated and is doing the right things.
Right.
Mm-hmm. Okay. For those pets anyways, right? And again, just because it's limping on one leg doesn't necessarily mean surgery on that leg. Right? Maybe there's something else. If it's limping on the right hind leg and you're like, oh yeah, well, it's got hip dysplasia. I'm like, yeah, but the hip dysplasia is in the other leg. So why is it, let's look at this and figure out what's going on before we rush to surgery or rush to any specific treatment, right? We just want to know, look outside your box.
Well, and look at the patient, feel the patient. So it gets back to the basics of medicine. Examine your patient, listen to the history, have hands-on, because that big missing piece of the myofascial examination, and even a little bit of neuro exam doesn't hurt either. So, or more even neuro exam, but just, feel the patient and what makes sense. And you don't need to jump to a lot of expensive diagnostics. And even if one did and didn't localize the area enough, you're wasting money and time and everything because you're looking at the wrong area. So again, it's just better medicine, better regular medicine, and more options, and empowering the clients, empowering practitioners to bond and to make different choices instead of just drugs and surgery. So,
well, absolutely.
Yeah. Well, thank you for being an ambassador of all this goodness and helping all the animals and people that you are helping.
Well, thank you, because without you, I never would have learned any of it.
You for helping communicate.
Okay, you're going to become Canadian if you have one more thank you.
I know. Oh, I'm so sorry.
So sorry. Thank you.
So sorry. Thank you. I almost was Canadian, and I daily wonder.
So close.
I know. I still might make
next week. You might change your mind.
Yep. I know how to do it. That'll be the third move north. I know the process well. Well, thanks. And I hope to do these more, so we will help people survive veterinary medicine.
Absolutely. Thanks, Marta.
Thank you. I'll talk to you soon.
Okay.
Bye.
If you'd like to learn integrative medicine from a scientific perspective, visit us at CuraCore.org. Thanks for listening to another installment of Surviving Veterinary Medicine.